Hello, I'm Dr. Maria Corcoran from the University of Washington. In this National HIV PrEP Curriculum mini-lecture, I will discuss the landmark Purpose 1 study, which evaluated twice-yearly lenacapavir, or daily oral FTAF, for HIV prevention in women. In 2023, there were an estimated 1.3 million new HIV infections globally, 40% of which occurred amongst women and adolescent girls. While oral FTDF and long-acting injectable cabotegravir are effective in preventing HIV infection amongst cisgender women and girls, uptake and sustained use of HIV PrEP has been low in this population. Lenacapavir is a first-in-class HIV-1 capsid inhibitor administered subcutaneously every 6 months. Lenacapavir is currently approved for use in highly treatment-experienced persons with HIV, alongside additional antiretrovirals. Prior to this trial, it had not been studied for HIV prevention. FTAF is a co-formulated tablet containing M-tricytidine and tenofovir alafenamide, which is used in HIV treatment and has been approved for HIV prevention in men. Prior to this trial, FTAF had not been studied for HIV prevention in women and girls. The Purpose 1 study was a Phase 3, multi-center, double-blind, randomized controlled trial that aimed to investigate the safety and efficacy of twice-yearly subcutaneous lenacapavir and daily oral FTAF for HIV prevention amongst adolescent girls and young women. The study was conducted across 25 sites in South Africa and 3 in Uganda. Participants were randomized in a 2-to-2-to-1 fashion to receive subcutaneous lenacapavir every 26 weeks, daily oral FTAF, or daily oral FTDF. The primary objective was to determine the efficacy of lenacapavir and FTAF for HIV prevention when compared to prospectively measured background HIV incidence in the screened population. To be eligible for this trial, participants had to be women and girls ages 16 to 25 years of age, be sexually active with male partners, not be using PrEP, and have an unknown HIV status with no HIV testing in the prior 3 months. Participants underwent HIV testing with a rapid point-of-care 4th-generation antigen antibody test and a quantitative HIV-1 RNA test. HIV-positive samples were tested for recent HIV infection using a limiting antigen antibody avidity assay, and HIV-positive persons were referred to care. HIV-negative participants were randomized to subcutaneous lenacapavir every 26 weeks with a once-daily oral placebo versus daily oral FTAF with a subcutaneous placebo every 26 weeks versus daily oral FTDF with a subcutaneous placebo every 26 weeks. Participants were seen for follow-up at weeks 4, 8, 13, and then every 13 weeks thereafter. Safety laboratory, pregnancy, and HIV testing, both point-of-care and laboratory-based antigen antibody testing, were conducted at each visit. Gonorrhea, chlamydia, trichomonas, and syphilis screening were performed at baseline and then every 26 weeks. Adherence to lenacapavir was defined as on-time injections within 28 weeks of the previous injection, meaning that injections could occur up to 2 weeks after the target date. Adherence to FTAF and FTDF was defined by measuring tenofovir diphosphate levels in dried blood spot samples, with low adherence correlating with less than 2 tablets per week, medium adherence correlating with 2 or 3 tablets per week, and high adherence correlating with 4 or more tablets per week. In total, 8,402 adolescent girls and young women were screened, and 8,092 had HIV testing performed. Of those, 504 received a diagnosis of HIV, and 92 were classified as having been recently infected with HIV. There were 2,138 individuals randomized to the lenacapavir arm, 2,137 to the FTAF arm, and 1,070 to the FTDF arm. The average age across all arms was 21, and greater than 99% of participants were Black. Baseline STI prevalence was high and similar across arms. Between 5.7 to 6.7% of participants across the 3 arms had any previous PrEP use. A total of 55 incident HIV infections were observed in the study, 0 in the lenacapavir arm, 39 in the FTAF arm, and 16 in the FTDF arm. Lenacapavir reduced HIV incidence by 100% when compared to the background incidence, which was estimated to be 2.1 infections per 100 person years. HIV incidence with FTAF did not differ significantly from the background HIV incidence, and there was no significant difference between HIV incidence in the FTAF and FTDF arms. Adherence was assessed on the basis of tenofovir diphosphate levels in red cells in dried blood spot samples from all trial visits from a randomly pre-selected 10% of participants in the FTAF and FTDF groups. As shown in this graph, only 48% of participants in the FTAF group and 22% of participants in the FTDF group were found to have high adherence at study week 8, and adherence waned over time. Most participants with incident HIV infection had low or no detection of tenofovir diphosphate. In the FTAF group, participants with medium or high adherence had a lower odds of acquiring HIV infection than those with low adherence, with an odds ratio of 0.11. The most common adverse events, aside from injection site reactions, were headache, urinary tract infection, and genitourinary chlamydia infection. The percentage of participants with adverse events was generally similar across the trial groups, except for a lower percentage with nausea and vomiting in the lenacapavir group. The rate of serious adverse events was overall low and similar across groups. Only 4 individuals prematurely discontinued lenacapavir due to injection site reactions. There were 510 pregnancies amongst 487 participants, 193 pregnancies in the lenacapavir group, 219 in the FTAF group, and 98 in the FTDF group. At the time of the interim analysis, 277 pregnancies were completed and 233 were ongoing. 12.9% of pregnancies ended in spontaneous abortion, with rates of spontaneous abortion ranging from 10.4% in the lenacapavir arm to 15.5% in the FTAF arm. A congenital abnormality of polydactyly was observed in an infant born to a participant in the lenacapavir group who had a strong family history of this condition. This abnormality was considered by investigators to be unrelated to the drug. In conclusion, lenacapavir reduced HIV incidence by 100% when compared to background HIV incidence and incidence in the FTDF arm. HIV incidence with FTAF did not differ significantly from background HIV incidence or that observed in the FTDF arm. However, adherence to both FTAF and FTDF in this study was low. Injection site reactions were common in the lenacapavir arm, but nearly all were grade 1 or 2. To learn more about HIV PrEP, please check out our online National HIV PrEP curriculum, which contains a variety of lessons, cases, and slides to reinforce your knowledge. Thanks for joining me today.
The production of this National HIV PrEP Curriculum Mini-Lecture is supported by Grant U62PS924588 from the Centers for Disease Control and Prevention and U10HA32104 from the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the University of Washington IDEA Program and do not necessarily represent the official views of CDC, HRSA, or HHS. This project is led by the University of Washington Infectious Diseases Education and Assessment Program.